So welcome to the Rotary District 6920's live broadcast. We're here to update you on the good news happening with our clubs. And today we're going to talk about Saving Lives with Medicine, a program that started in 2017 with past District Governor Hamza. The Rotary program is in partnership with MAP International and 7 area clinics around Georgia that receive free medicines and health supplies to uninsured patients. So today's guests, Sister Pat with St. Joe's Candler, Andy Long, our incoming district governor, and Tom Woodbury, an AG from Macon. Welcome to the Rotary broadcast. Hey there. Andy, you are here to announce that 10 area clubs in Savannah have signed up to help fund this project. Tell us about this.
I am. This is just a wonderful opportunity. We have in the past been able to support 5 different clubs throughout our district in Southeast Georgia, where MAP International, who is a top-notch 501c3 organization, who has in the past provided medicines around the world to people in need. They take medicines from the big pharmaceutical companies when the medicines are coming close to their expiration date, and they use those medicines to treat individuals. One of our past governors said, why don't we try to partner with MAP and use these medicines in our free clinics throughout our district in Georgia? And from that idea came this Saving Lives Through Medicine program. And to date, we have 5 clubs that are being supported by a number of Rotary clubs locally. MAP provides the medicines, and the Rotary clubs provide the shipping cost.
Yeah, there's a picture of MAP.
MAP is, and for any of us who have a connection with MAP, we are very honored to be able to work with them because they are, according to Charity Navigator, one of the top charities in the United States, along with Rotary International. So the two joined together. The programs have been phenomenal. They have seen a dramatic positive impact in the lives of individuals who are using these free clinics. And these are not people who qualify for means-tested government benefits, by and large. These people are working poor. They do not have insurance, but they, like all of us, have medical needs. So the medicines provided are really for the 4 biggest medical needs that folks have. It's high blood pressure, diabetes, high cholesterol, and asthma. And by providing medicine for these 4 chronic conditions, we are, number 1, improving the lives of individuals, and number 2, we are taking a strain off the other healthcare systems whereby these individuals would have to go to the emergency room for treatment. So we have been working with the Rotary clubs in the Savannah area to help provide the shipping cost and work with MAP International to provide medicine to 2 free clinics that are operated here by the St. Joseph Candler Hospital under the auspices and through the good work of Sister Pat. And we are now announcing that we have put together this program and it will be rolling out here very shortly.
Very good. Sister Pat, yay, I know. What does this mean for St. Joseph's Candler and the 2 clinics?
Oh, it's fantastic, terrific, phenomenal news. I mean, it is such a gift. Our patients, almost every single one of our patients have multiple abilities. So they don't just have hypertension, they have hypertension and high cholesterol and diabetes. So, you know, this is going to cover medical costs for a lot of different things just for one person. I mean, one person is going to get, you know, triple the benefit, quadruple the benefit. I mean, that's huge. That's huge. I mean, Andy was right. These are the working poor. Most of our patients in Savannah, the low income work, the jobs are in a part of our tourism industry. So they work in the kitchens, they work in the hotels, and they're grateful for the jobs, but none of them have insurance. Or if the hotels or whatever offer insurance, they don't make enough money to participate in health insurance. So this is huge. You know, we can do only so much. Medicines are a significant scientific breakthrough that really makes a difference in our lives, in everyone's life.
Well, that's wonderful that Rotary's been able to partner with St. Joe's Candler and help figure out the logistics of getting all the medicines, much needed free medicines to these clinics. Tom,
Yes.
I know it's moving the needle. I know people are getting better. I'd love for you to share with some statistics about how people are actually getting better.
Marjorie, it is really astonishing. And I was optimistic, but I had no idea. And now we have 3 years worth of data on reports that each of the clinics, the participating clinics, send those reports back on a quarterly basis. So we're tracking how are the patients. And thus far, we've served over 4,200 patients with over 10,000 treatments in the first 3 years in the clinics that are being served by our clubs. But the numbers for health improvement, which is really the bottom line, because our main goal is to make people healthier and give them an alternative, as Andy says, to going to the emergency room for primary medical care. So the numbers for hypertension in the first 3 years, 50% of the patients who suffer from hypertension have seen improved health conditions. Wow. Diabetes patients, 61% diabetes patients have seen improved health levels. And cholesterol patients, the improvement is to 63%. Actually, asthma, which is probably the fewest number of our patients suffer from asthma, but even asthma is at 82% in improved health. So it's been fantastic.
That's really impressive. And I'm so excited to learn that 10 more clubs in our district are signing on to help with that. Is that right, Andy?
That is right. And what is so wonderful from our standpoint is we project that we'll be able to assist about 4,000 patients in the Savannah area with what we're doing. And by spreading the load, so to speak, across 10 different Rotary clubs, no one club has to really spend a tremendous amount of money. We essentially are doing this based on a per capita for the membership. So the larger clubs will pay a little more, the smaller clubs will pay less. And as a result, they are directly reaching out to their fellows in the community and providing help and providing necessary medicines to these folks. And this is truly what Rotary is all about. And I get a little choked up thinking about it, just what a wonderful opportunity this is. And when we presented this idea to the Rotary clubs, they jumped at the chance to be involved in it. And I have to commend Tom Woodbury, incredible work that he has done in managing this program. And we could not have done it without Tom. And I really am so very happy to be working with Sister Pat. She is I want to say a legend in a wonderful way in the Savannah community about serving underserved populations in our community. And it is just kind of like 3 or 4 different parts coming together that all fit perfectly. And so we're extremely happy to be working as a team with St. Joe Candler, with MAP International. And once again, a huge pat on the back to Tom for putting this all together.
Tell us a little bit more about MAP International and what they do.
I'm happy to. I have been very pleased to know a little bit more about MAP International. MAP International is started as a Christian organization. It's a 501c3 organization that takes donations from large pharmaceutical companies. There are certain rules in the United States that say if a medication is within 6 months of its expiration date, it cannot be shipped out to a U.S. Facility. But there is still a tremendous amount of life in those 6 months. So
Yes.
MAP International has taken those donations, packaged them, and sent them to places where there is need. And we are able to use those same medications in our clinics here in our area of Georgia to provide care to individuals who need it. And MAP International is wonderful. I go to the website of MAP International and find out more about them. Gentleman who is the head of MAP International is called Steve Sterling, and he is an inspirational individual. He is a polio survivor, and he is just a wonderful leader and a wonderful history and story that he brings to MAP International. And they're truly one of the good guys. Charity Navigator, which is a big charitable rating organization, so to speak, has a number of criteria that they look at each 501c3 organization. And there are only 2 or 3 in the country that reach this highest level of certification. And MAP International is one. Rotary happens to be another, but we'll leave that to the side. But they are incredibly well-run, incredibly dedicated individuals at MAP International. And it has, once again, it's been a pleasure to work with them, and it has worked truly hand in glove to put these programs together to serve the underserved communities. And now we are just incredibly excited to be working with St. Joe Candler.
So if there's clubs that are watching this and they are interested in signing on to also be part of this movement, how do they do that?
Call Tom. That's
right.
That's the best way to
right.
do it. Tom has been instrumental.
Andy, yeah, Andy, it's because there are dozens of free and charitable clinics throughout Georgia. There may be one, if you're in a club in our district, there may be a clinic that's not too far from you that you should reach out to and find out how they're serving their patients with medicines, and could our medicines life-saving program help them. But we also need help. And I think it's fair to say that, we want to broaden the base of the partnership. We've got a great partnership with Rotary, our district, with Rotary clubs, 28 Rotary clubs in our district, and our clinic partners and MAP International. But we would love to be able to expand that support level. And so that may mean individuals in your community. It may be companies or foundations or hospitals that are looking for ways to expand their outreach. So look for partnership opportunities, I would say, as well.
How many more clinics do you anticipate bringing on in 2021?
Well, the clinics, in the 2 clinics in Savannah, led by Sister Pat, that Andy has talked about, is our most significant. We're also starting very shortly another clinic in Dublin, the Joy Health Clinic, and the Dublin Rotary Club there is taking the lead in supporting that effort. So those are the Savannah clinics, and the Dublin clinic are our 2 next moves. And we do have some other communities that are talking about starting of free and charitable care clinics in their communities.
So Sister Pat, if somebody's watching that does not have insurance, how can they get in touch with your clinics about being a patient there?
Right. And we welcome any new patient. So they can go on the St. Joe Candler website and leave a notice with their phone number or their email, and it comes directly to me, and I would call them and invite them to whichever clinic is closest to their home. But if they're watching, Good Samaritan is over in Garden City, and that phone number is 964 4326.
Okay.
St. Mary's is on Drayton Street, and that phone number is 443-9409. And, good things happen all the time when there are good people who get together, collaborate. That's what makes it. We're riding a wave of goodness. It's the good.
Chill bumps.
Yes. So many people that are making this happen. And Tom, wow, I wrote down those statistics. That's amazing. And those statistics plant so much hope, not only for our patients, but also our staff who, we have so many patients with A1Cs at 13, 14, 18 even.
Wow.
This says, yes, it can be done. You can overcome this, that this is not going to lead to terrible complications of blindness or amputation. We're here to help. And, it's not a small team that's backing them up. It's a huge team that all of you are a part of, that are standing behind these people and our staff to say, we can make a difference. Let's do it together.
Sister Pat, is wonderful what you do with St. Joe's Candler and the outreach that you have with our community. I don't know where a lot of these folks would be if they didn't have.
I depend on the goodness of all these people. So it's a ministry that we all participate in, and I'm blessed to be a part of it. So thank you.
Yeah, absolutely. Thank you. And Andy and Tom, where can people, we're going to reach out. Can they give your phone number or your email, Tom, if a Rotary Club wants to be involved?
Yes, that would be fine. My email is twoodbury@gmail.com. And my phone number is 478-737-2771.
Very good.
And Marjorie, if I could make one more statement, really follow up on something that Tom said, is we are really looking for partners outside of Rotary who want to get involved in this process to broaden the base of our contribution, and for churches, for charitable organizations, for foundations, and for charitable-minded individuals who want to be a part of this program. We are happy to speak with you and hopefully work with you to expand this program, because we just see this as a model, a pilot program, if you will, to how we can come together as community and reach out to those who need it. And we have the medicine through MAP International. I don't think there's any almost no limit to what we can get in terms of medicine for what we need. Additionally, it's only limited by our ability to get the medicine from MAP to the free clinics.
And that's where the leadership and vision has come in ever since 2017. I saw it happening and unfolding, and it just kept getting bigger and bigger and more momentum. And how wonderful that it is absolutely moving the needle. Kudos to Rotary. So
yes.
Yes.
And to put in a little plug for Rotary is Rotary is an organization of a little over 1,200,000 people worldwide who are committed to our motto of service above self. And we're wanting to work in our communities to better the communities and to see those communities live better lives, live healthier lives, and more productive lives.
Absolutely. Well, Andy and Sister Pat and Tom, thank you so much for taking time out today. And everybody watching, thank you for watching. Go Rotary. Okay.
Go Rotary.
Yep.
Thank you.